Lecture na tayo The best prankster of the year. Hello everyone, how are you?
Sir, prankster ka na ngayon.
So welcome to finals.
Nice welcoming.
Few more months to go before you will... Ano ba? Ano na naman?
Murahan ko.
Okay, let's start our lecture now. So we're going to learn module 4, the fourth module out of the 6th module under your community of nursing 2. So for today's lecture, we're going to start reviewing again the nursing process in the care of the population and community. At the same time, we are going to also review, some of the things that we already did in the community, during your community duty. Okay, so let's start the discussion. So module 4, nursing process in the care. Let us review first the things that we have discussed during your first or midterm grading period. So, pasalaman natin, the community assessment tool, as we already know, the collection of primary data and your secondary data. So I think I don't need to elaborate more on this already because I already discussed this during your midterm. So, but if I may, for the sake of those who are not listening during those times, so primary data are the data that are collected directly from the community people. While your secondary data are the data we have collected, from the documents and files that has been filed in the health center, in the barangay, or any information that already been published, and documented in the community. So I believe na-discuss natin yun, tama? So let us just have a review, quick review. When you say primary, secondary data, tell me it's a primary data or a secondary data. Okay. Sige. So tell me if it's a primary or secondary data, guys. Primary or secondary data. Of course, we have your your family treatment record. Primary, secondary. Primary or secondary? It's your secondary, okay? Secondary. How about your ano ba? How about your mother and child record? Secondary. Okay. I-live nga natin itong video na to. Trip ko lang. Iharap ko sa inyo ha. Tapos sasagot kayo. Did you get it? Hindi, iharap lang natin dito. Ay, nakita ka doon, Miss Babida. Okay. Data privacy, sir. Kung naman Wag lang gagalaw, wag lang ihinga, matutumba. Okay. Okay na yan. Okay. So methods in presenting the data, we already discussed it. Let's move forward. For the primary data, guys, again, this is the data collected through the primary sources, which is the community people. And secondary data are from the books or published documents in the community. So information is obtained directly from the first-hand sources. Okay, first-hand sources. So sino yung mga first-hand sources na ito? Ito yung mga community people. Isn't it? Yes. So the community people, first-hand sources po natin yan. Aside from that, guys, we have your primary data sources, an original data source that is one which the data are collected first-hand by the researcher for a specific purpose or project. For a specific purpose or project. So like for example, if you're going to conduct a community health survey, or if you're going to conduct a data source, census, those are examples of your primary data sources. So primary data sources are collected through observation, using your senses. Of course, you have to make use of your sixth sense as well. Okay, kadalasan nakakalimutan natin sa bahay, isn't it? Ang sixth sense. Okay? Next, your common sense, of course. Survey, information interview. Okay, on format interview and your community forums. So community forums such as your community assembly. Those are possible primary data sources and methods that we can use to collect primary data. Okay. Now, for the review lang naman po ito. Actually, na-discuss ko na ito nung midterm. Binibisita ko lang kasi nga, we're going to enter the next phase of the discussion, which is in the diagnosis part. So I have to review all of these concepts so that you'll be able to connect it later on in the assessment, in the diagnosis and the planning part of the community health nursing process. Now, for the primary data source, observation, just like I mentioned, commonly used in studies relating to behavioral science, and the data from the field is collected by personally going to the field, meaning using your senses. So using the sense of sight, ano pa? Hear, what else? Sense of touch if you want to. Kung gusto mong hawakan ng iyong community people, what else? Amuyin ang bahay nila kung gusto mo. Saka mo i-describe na nasty. Bakit? Okay? Then, observation may be defined as systematic viewing coupled with considerations of seen phenomenon as described by P.V. Young, okay, which is based on our book. Let me continue. We'll talk about primary data source under your survey. As we already know, survey is an assessment method in which a series of questions is used to collect data for analysis of a specific group or area. So this is commonly used to provide a broad range of data that will be helpful when used in other sources if other sources are not available. And as we already know and used in the community setting, surveys are commonly used in a form of questionnaires. And these questionnaires later on will be converted to become an initial database and the basis for community health problems. So basically, mas nauna yung inyong duty kesa yung lecture natin. So more or less, mas may idea na kayo sa mga pinagsasabi ko dito sa harap. Okay? Let me continue. Informal interview. Okay? Informal interview or informal interview involves presentation of oral verbal stimuli and reply in terms of oral verbal responses that can be achieved through personal interview and telephonic interview. In terms of the informal interview, basically we are just going with the flow. So informal interview, again, informal interview is you just go with the flow. So during the conversation, you do have a set of questions, but you don't dictate, okay, yung flow ng interview. Actually, let the patient verbalize, okay, what they feel and what they think on how they perceive things. Because as we already know in the prioritization, we have what we call your salience and your social concern. So salience is basically the perception of the family, while social concern is the perception of the community as a whole. Okay? Now, for this informal interview, we have to take note not only the verbal responses of the patient, of the community people, we also need to take note of the non-verbal responses, such as the gestures, their actions, their facial expressions, because this will denote information that is necessary for us to identify the community health nursing problem. Okay? Primary sources, community forum, examples during your community assembly. It involves a series of discussion during which time participants discuss their needs and concerns. Okay? Participants discuss their needs and concerns. If you can still remember, during my discussion, during your community health nursing duty, the process of implementation of your programs in the community is different kapag tayo nasa school lang. Pag sa community kasi, of course, we start with collection of data. After the collection of data, guys, we are going to what? What is the next thing to do? We are going to collate the data. When you say collation, guys, what does it mean? So collation, basically, you're going to what? Collate. Ang galing. Ganun definition. You're basically going to, ano ulit? You're going to what? Categorize or group the information or the data that you have collected. So basically, ito yung kinategorize yung information nyo, kung siya ba ay included sa category. For example, is it an example of a community health status problem? Is it an example of community health-related factors problem? And is it an example of your community health resources problem? Okay? So that is basically yung isa sa discussion natin. And on that, we also need to conduct community forums in order for us to identify what are the concerns of the community in general. Why? Do we need to ask them? Yes, that is why after collation of data, what is the next thing to do? Analysis or presentation? Presentation. Why do we need to present first before we analyze? What's the general rule? In the community, should we involve the community people? Yes. So the decision making should not be made not just by the outsiders or the nurses. We have to involve the community people. And during the community assembly, dito natin i-announce. Hello po, mga taga-barangay Maligaya. Maligaya po ba kayo? So, during our community exposures po, nung kami umikot sa inyong community, ito po yung mga data na na-collect namin. And based sa mga data na na-collect namin, these are the categories, okay, na kailangan po natin tignan. Ngayon po, tinipon po namin kayo, nandito kayo ngayon, kasi hindi pwedeng kami lang ang magdesisyon sa bagay na ito. Kasi ito ay hindi namin problema lang. Ito ay mas problema ng inyong komunidad na kailangan nating solusyonan. Okay, kaya sa mga problema po ito, for example, unsegregated na basura, kawalan ng trabaho, maraming high blood, maraming diabetes, maraming hindi bakunado. Sabihin niyo po, alin po kaya ang pinaka-problema dito? Yes, ma'am. Yes, sir. Yes, ma'am. Then after that, we're going to what? Collect all the opinions from the community until such time we'll be able to decide which problem is our priority. Clear tayo? Yes. Kaya nga sa aking prioritization, one of the criteria, the last criteria is social concern. Social concern means perception of the community towards the identified problem. Is it a problem? Is it an identified problem? If it's not, the score is 0. If it's an identified problem but they don't think it needs an urgent attention, score is 1. At pag sa tingin nila, ito ay problema at kailangan ng madaling solusyon, score is 2. So for those who actually did yung ating community health prioritizations, they know what I am referring to right now. Pero sa mga nag-speculate na, kamay sabi, tapos na ba? Ang oras na uwi. Nagmagano'n lang, malamang hindi ka nakakarinig kasi sinasabi ko ngayon. Okay. May mga ganun ba kayong classmates? Yung ba't ibong utos-utos pero hindi niya pala alam yung utos niya. Did you get it? O, gawin mo daw. Hindi niya rin pala alam. Paano gagawin? Basta! Isa natin siya. Okay? So, saka pinarilingan ka. Hindi naman. Pero kung natatamaan ka, ikaw na yun. Did you get it? Okay? So methods is helpful in painting a picture of the community concern. Okay? And of course, this community forum would also give us an avenue to collect qualitative assessment. Okay? Qualitative assessment regarding the community's concern. Okay? Do you have any questions so far? Wala. Let me continue. Kasi na-discuss natin ito. Nire-refresh ko lang kayo. So the collection of secondary data source refers to the data collected by someone other than the user. The data is already available and analyzed by someone else. And this is a common source of secondary data includes published and unpublished data, books, magazines, newspapers, and trade journals, etc. Okay? Etc. So these are the collection of secondary data. Sabi nga, yan, unpublished and unpublished. Kasama po ba dyan ang mga journals? Yes. Kasama po ba dyan ang mga individual treatment records? Yes. Kasama ba dyan ang mga mother and child records? Vaccination reports? Yes. All of those are considered as secondary data. Okay? Now, for the secondary data, so before using secondary data source, you have to check its validity. Okay? Reliable po ba ang data na kinokollect ko? And in order for you to check if the data that you're going to use are reliable, okay, you have to check for the following characteristics. Okay? Reliability. So does it come from a reliable source? Galing ba yan sa health center or galing kay Maritex? Na binasa kay Marisol? Na binasa ni Maricar? Na binabasa kayo ni Margaret? Margaret. So another one, suitability. Not because the data is available in the health center, gagamitin mo na. You have to check, itong data ba na ginagamit ko sa applicable ba? Baka naman yung data na gusto mo nga, yung data na ginagamit mo is 1990, 2022 na. Okay? Suitability. And adequacy of the data. Is it enough? Okay? Nag-research kayo, right? So in your research, isn't it that you have to collect a certain population, then in the population, a representation of the population will be computed in order for you to find out kung gaano ba karami interviewin mo. Kadalasan yung mga ginagamit nyo is yung Stokes formula. Okay, pares din dito. Okay, so when you collect data, you have to make sure that the data that you're collecting is adequate. Okay, in order for you to check if the data source that you will be using are applicable doon sa gagawin mong community health diagnosis. Okay, so you have to check for these three characteristics. Let us go to the next one. Other secondary data source includes your registry of vital events. So if I'm not mistaken, emphasize ko na sa inyo to. Registry of vital events, ano yung mga examples nito mga kapatid? Ano na? Marriage certificates, what else? Death certificate, what else? Birth certificate, what else? Divorce, if you are abroad, sa amin sa US, right? Ano daw, sir? Ay, hindi mo ba alam? Foreigner ako, diba? Foreigner. Italiano, am I right? Ilocano, did you get it? Okay, so registry of vital events. Again, in terms of the registry of vital events, we are referring to the civil registry. And we talk about civil registry law, ano ulit to? Republic Act 37 or 357? 3753. Because 3573 is the old law for the reporting of communicable diseases. But for the civil registry law, it's 3753. So basically, all vital events should be reported and recorded in the place where it occurred. Nalala niyo yung principle natin? What is the principle in your civil registration, in your registration of vital events? Registration should be done in the place of occurrence. Did you get that? Yes. So kapag siya ay nabuntis sa Pangasinan, nanganak sa Baguio, saan ang registration? Baguio. Kapag siya ay nakipag-gerger sa Pangasinan, nabuntis sa La Union, kapag siya ng Baguio, nanganak sa Mountain Province. Saan ang registration? Province. Okay. Inatake siya sa Ilocos, namatay sa South China Sea. Saan ang registration? Try mo. Sino ang magawa sa iyo? Of course, okay. Kung saan siya uling nakita or kung saan siya uling namatay. Okay, so basically, kapag naman sa gitna ng dagat, ibabalik yan sa Pampang kung saan siya sinalo, no registration. Are we clear? Are we there? Yes. So civil registration law. So health records and reports, disease registries, census data, those are the possible secondary data sources. So registration of vital events. So it's a well-functioned civil registration and vital statistics mandated by Civil Registry Law, Republic Act 3753. Okay, so under this one, okay, births, deaths, issues about births and death certificate, and any vital statistics including the death of cause or the cause of death information will all be registered under the Registry of Vital Events. Okay, so sa munisipyo po ito. So records of marriages and divorces will also be included here. Now, for the Registry of Vital Events, Vital event statistics accumulated data gathered on live births, deaths, fetal deaths, and marriages and divorce. And this is the most common way of collecting information through civil registration in an administration system used by government to record vital events which occur in their population. Okay, and this will keep track, and the lead agency keep track our population in our census, and the lead agency that is performing this task is your Philippine Statistics Authority. So in terms of your civil registration, lahat po yan. So either pinanganak sa bahay, kahit bawal na, or pinanganak sa hospital, or kung saan man, late man or early, dito ang registration. Okay? So registration of vital events should always be done in the place of occurrence, just like I mentioned earlier. Okay? So health records. Health records are permanent written communication that documents health information relevant to the clients and care management. So it's a clinical, scientific, administrative, legal document relating to the nursing care given to the individual, family, and community. Example of your health records is your mother and child record, immunization record, family planning record, and so on and so forth. So health records po yan. Aside from the health records, we also have your health reports. Okay, the difference between the health records and the health record is that records commonly kept, okay, it's a primary level of healthcare facility, while reports are being forwarded to a higher level of healthcare facility. Like for example, sa provincial office or sa ating DOH office. So what are example of your DOH reports or health reports? Example is your dengue surveillance monitoring report. We also have your check-up report. So, naalala ko, ginagawa namin yan when I was still a community health nurse. And your community profile and updating report that we also submitted in the health center for profiling. So, lahat po yan. And take note, just like I've mentioned when I was discussing your vital statistics. When you do reports, it has to be truthful. Why? Because the product of these reports that you will be submitting will be the basis of the procurement of logistics later on. So kung mali po ang report doon sa pinakamababa, mali na din ang i-forward. At mali din po yung mabibiling logistics. Are we clear? Yes. Okay? Disease registries. Under Republic Act 10747, also known as the Rare Disease Act of the Philippines, establishes that maintain the rare disease registry in the Philippines, patients afflicted with rare diseases and orphan drugs and orphan products. Okay? It also covers the registration of diseases under surveillance, which is mandated by Republic Act 3573. But it is already updated, isn't it? What's the new law? Republic Act? Ano naman, 11.7? What is the new law? What is the new law? Ay, pag-isa-isa. What is the new law? Ano? 11.33.2. The Public Act 11.33.2 or the Reporting of Communicable Disease Act of 2011, if I'm not mistaken. Okay? So yun na po. So na-amend na po yung Republic Act 3573. Ang bago ng batas is Republic Act 11.33.2. Okay? So census naman po, information about the members of the Philippine population collected from the government census. And the census is regularly occurring in official count of particular population. In the Philippine setting, your Philippine census is being conducted every 5 years. The last census was held in year 2020 during the pandemic. Okay, and the next census will be held on 2025. Okay, every 5 years po kasi yan. And as of the most recent data, population, this is 2019, 108.7 million tayo. Pero recently po ata umabot na tayo sa 111 million. Ganun po talaga. We are ranked 13 among the most productive country in terms of fertility. Is that good news? Pag good news yun, ibig sabihin, kukunti ang baog. Okay. So may kinalaman po ba kahirapan sa pagkakaroon ng maraming anak? Parang meron ano? Okay. Kasi nga walang magawa sa bahay, walang ilaw. Maraming nangyayari pag madilim. Did you get it? Sana all muna lang. Okay, next. Methods of presenting data. So we have descriptive. Pag descriptive po, we make use of narrative reports, and kapag numerical data, we make use of tables. Okay? So community diagnosis refers to the nursing diagnosis about the community's ineffective coping ability and the potential to enhance coping. Just like I mentioned and trying to emphasize every now and then, when we go and try to assess not only the community but also the patient in the hospital, okay, the problem with us, okay, that will lead to us having concern in one particular problem ang ita-chart natin. Kasi nga, we're always asking the wrong questions. Ang lagi kasi natin hinahanap yung problema. Okay? Take note that in the community diagnosis, and even in individual diagnosis, there is such thing as strength. So yung strength na to, ito yung mga diagnosis na pwede natin gawin in relation to the community or to the individual's strength. Okay? So that when you try to assess the community, you have to include the strength of the community, the possible resources, and of course, the weaknesses and problems in the area or in your catchment area kung saan ka man po nade-deploy. Okay? For the types of community assessment needs, under your community diagnosis, we have to identify the assessment needs, and in order for us to identify the assessment needs, we have to make use of the tools. Okay? The types of community needs assessments in the community, I know that you're already familiar with this one. We have 5. Give me one. Familiarization. Another one. Problem. Another one. Community subsystem, comprehensive, and assessment. Okay, assets assessment. If I am going to find out the strength of the community, which of these should I use? Assets. Very good. If I want to focus on a single issue or a problem, what will I use? If you're problem-oriented. If I want to analyze the community, okay, or to get an initial data by just roaming around the community, familiarization. Best example na ito ng spot mapping. Okay? And of course, community subsystem if you want to focus your assessment to a particular sector of the community. For example, you want to study the religion, you want to study the ethnicity, yeah, subsystem. And of course, if you want to study the entire community of things, we make use of the community comprehensive assessment. Did you get that? Yes. Okay, familiarization or ratio. So let us proceed. Okay. Let us proceed with the community diagnosis. So this is the actual process, guys. So once we already collected all the data from the community, we are now ready to diagnose the community. So basically, diagnosing the community is identifying what is the problem. So nandun na tayo sa part na ang identification of problem, which is part of your nursing diagnosis in the practice sa community health nursing process. Now here, the process of community diagnosis consists of collecting, organizing, synthesizing, analyzing, and interpreting the health data collected, okay, in the community. So basically, before she collects or before he collects the data, the objective must be determined by the nurse as this will dictate the depth of the scope of the community diagnosis. Kaya kung mapapansin nyo kanina, diniscuss ko prior to community of diagnosis is yung tinatawag natin types of community assessment needs. Kasi nga, if you're not able to know or we don't know the objective of the community exposure that we're going to perform, okay, we will lose track kung ano nga ba yung gusto natin gawin sa community. So basically, if we want to improve the community health status, it's either we focus on the community's strength by using the assets assessment or we focus on the community problems by using your problem-focused assessment. Pero kung ikaw naman ay masipag-sipag, yung grupo niyo masipag-sipag, you have all the time on earth, okay, gusto mong ilaan yung 5 to 10 years of your life to empower the community, then you go and use the comprehensive assessment tool. Okay, so lahat ng problema yung strength, paghalu-haluin mo na. Okay, so yun ba yung gagawin natin? So she needs to resolve whether a comprehensive or a problem-oriented community diagnosis will accomplish her objectives. Okay? So there are several steps in conducting your community diagnosis. So in order to generate a broad range of useful data, the community diagnosis must be carried out in an organized and systematic manner, keeping in mind that the community should take active part in identifying community needs and problems. Let me just emphasize that the community people should play an active part. So the community people should not be detached. You should always communicate with the community people. So madalamang po yan sa madalas nagkakaroon ng community assembly. Of course, during our community exposure, we are unable to do that in a proper way because of the limited time. Okay, but in actual setting, once you become a community health nurse and you opted to become a community organizer, okay, whatever projects and data, whatever data you have collected, whatever projects that you have in mind that you want to suggest to the community, it has to be consulted with the community people because the decision making should be majority in their hands. Okay, yun po ang ating concept. Kung babalikan natin ang general concept ng community health nursing, what is our primary goal? Enhancing the capability of the people. Ano say, enhancing the capability of the people, parehas din sa self-reliance. Yes. Okay? So you want them to become self-reliant. So conducting community diagnosis, determining the objectives, the community diagnosis, the nurse decides on the depth and scope of the data she needs to gather, but whether she undertakes comprehensive or a problem-oriented community diagnosis, just like I mentioned earlier. That's why you really need to take note. Okay, pupunta kami sa area na ito, ano bang gusto kong gawin? Should I just be improving whatever strength they have? Or should I focus on the problem they have? Or I will cover everything about the community assessment. I will cover everything about the community health needs. Kaya dyan, comprehensive or a problem-oriented assessment. So I was able to discuss it earlier na. Okay? Now, steps in the conducting community diagnosis is based on the objectives of the community and it will include the entire population in the community or a focus of a specific population. That is why I made a video about the levels of prevention, levels of clientele. Tama? Because you can also focus your programs targeting a specific population group. For example, school nursing. School nursing is actually covered or part siya ng CHN2. Kasi nga, the school population is a sector of the entire population. So if you want to focus on the needs or specific needs of the school population, okay, then you have to what? You have to focus your programs and identification of data based on sa mga pangangailangan ng school population. Okay? In that way, you'll be able to remove kung ano yung mga hindi na kailangan. You can also do this in a age-specific group. Like for example, you want to create a program regarding the health needs of senior citizen. Then yung focus ng assessment mo is senior citizen. So it's either you're going to focus on their problems, on their strength, or you want to focus on their problem as a whole. So in that case, you're going to make use of your comprehensive assessment. Okay? Pwede naman group of pregnant women. Ano pa? Group of children ages 1 to 4 years old. Kasi alam mo na mataas ang malnutrition rate doon sa barangay. Okay? Or, gusto mong i-focus yung program mo sa mga pasyente na may lifestyle-related diseases. So, for example, yung may mga diabetes mellitus, ano pa? Hypertension, ano pa? Cancer, ano pa? Any non-communicable diseases. Okay? Lifestyle-related diseases. Stroke patient. Okay? So, those conditions. Okay. And there are situations, however, when a complete enumeration of the desired population is not possible, the nurse then may collect data from the subset of the population. Okay? Still, under your community diagnosis, you have to determine the data to be collected. So whether the community diagnosis is going to be comprehensive, focus on a specific problem, the objectives will guide the nurse in identifying the specific data she will collect. She also decides on the sources of this data, and you would ask the question, are this data available from the record agencies or from the people themselves? Kasi nga, kung hindi naman available, then you are making it hard for you as well. So you have to make sure that before you set the objective, all these things should be taken into consideration. Okay? Another one, okay, the nurse also decides on the specific methods depending on the type of data to be generated. For example, through an ocular survey, you have noticed that or determine the physical and topographical characteristics of the community. So you may also interview people about their health beliefs, or she can review existing health records in the rural health unit. And in general, we use the following methods to collect data. So what are these methods? Records review. Okay, so pwede ka punta sa records review. Tignan mo kanilang registry. Ano yung number 1 cause of death in the community? So kung i-relate natin sa Pilipinas ngayon, okay, the number 1 cause or the top cause of mortality and morbidity in the Philippines is what? Still your cardiovascular diseases. Followed by your stroke, di ba? And if we try to analyze, stroke and cardiovascular diseases are both lifestyle-related diseases. Bakit kaya? Below 1990s, the most common cause of death and mortality and morbidity in the Philippines is more on communicable diseases. Okay, bago pa naging effective ang mga bakuna. Okay? Pero ngayon, mas marami na po ang namamangatay sa mga lifestyle-related diseases. Why? Because of the lifestyle we have. And talk about lifestyle, Baguio alone. Paglabas mo ng school, Jollibee, diba? McDoby, Chowking, Inasal. So lahat po ba ay fast food? Yes. At karamihan sa mga ito, unhealthy po ba? Yung friend mo, naninigarilyo. Mamaya, toma-toma kayo, right? Diba? Yung jowa mo, kala mo mahal na mahal ka, right? I love you, babe. Kami, unti-unti kanya pinapatay, hindi kagere. Diba? Wala bang pinagkaiba ang usap ng tambol sa sigarilyo? Yes. Sa mga natamaan, congratulations. Okay. Isa pa ang number 1 candidate. Pwede na magkaroon ng erectile dysfunction later on. Okay. Okay. So records review, check mo. Baka marami pang hindi na mabakunahan ng COVID-19. Can that also become a problem later on? Yes. Okay. What else? Aside from the records review, another sources is your survey and observation. So during survey, nakita mo na karamihan sa kanila ang problema, trabaho. Diba? So is that an assessment needs? Yes. Okay. During the interview, you found out that majority of the population is still unvaccinated of COVID-19. Is that a problem? Yes. Okay. During the home visit, you will be able to, during the observation, okay, during the observation of the community, you found out that mostly ang kinakain nila is kamote. Okay. Lalo sa mga southern provinces, Pilipinas, kamote na kulang sa sustansya. So pwede ba ito mag-lead into malnutrition cases? Yes. Kapag kulang sa protein ng mga bata, ano yung sakit ulit? Kwashiorkor, marasmus. Protein. Kwashiorkor, marasmus. Kwashiorkor, because marasmus is more on calorie deficiency. Diba? So between kwashiorkor and marasmus, sino mataba? Ano ikaw? Sino rin? Kwashiorkor. Okay, kasi nga, yung fluid accumulation because of the shifting of fluids from intravascular to interstitial space. Nakuha? Yes. Okay? Interviews can yield hand information. Okay? Interviews through, ano tawag dito? Communicating with the community people. And of course, participant observations. used to obtain quantitative data by allowing the nurse to actively participate in the life of the community. Kaya nga, later on, ituturo ko sa inyo ang COPAR. Kasi under your COPAR, i-discuss natin yung tinatawag ng community integration and immersion. So, community integration and immersion is that you will live together with the people. So, titira ka talaga dun sa community. That is actually the original plan of your community exposure. Oo. So, literally, we're going to sleep in the barangay hall, or we will choose a house recommended by the barangay kung saan kayo pwede makikitulog. For example, may isang group tayo, group of 12 students, they will stay in the community. Si Miss Ganito matutulog sa house number 1, si Miss Ganito matutulog sa house number 9. That's why we have to coordinate with the LGU in order to look for a family that we think is pasado doon sa guidelines natin or criteria na safe family na pwedeng samahan. Hindi naman yung basta itira ka lang doon sa bahay. Parang mo naman serial rapist naman. Okay lang sana sa itong pogi. Paano pag-chararat ko naman? Well, of course, rape joke yun. Sorry, hindi maganda. Tanggal, remove. Tuloy tayo. Tuloy. Okay, participant observation. Kaya nga, when you go to the community, like for example, tumagsa sa kasila, dapat tumagsa sa kakalim. Yes, you will help in the farm. Ano yun? Pumunta silang bukid. Kamusta po kayo, ma? Going to the farm. Kung ko nang dyan, farmville moment. Kung ko nang dyan. Hindi ka naman talaga nagtatrabaho. Diba? Hindi naman talaga nagtatrabaho. So you have to do that. For example, gusto mong makakuha ng information. Pumunta ka sa tindahan ni Aling Beba. May nagkikwentuhan. Habang nagtotoma. Will you join them? Yes. You can join them. But will you drink with them? Yes. No. Lumano ko sa mga sangal. Okay. Kayo yung kasama nila. But you can join them. Okay? Then magpapwentuhan. Hello po kuya. Ito po pala yung past time nyo rito. Wala po ako lang. Kamusta naman po ako na ba ako maghapon? Ano daw? Talaga namin ang basa. Sige po kuya. Ito talaga ako. Pwede ka makisama na hindi nalalasing. Maraming nangyayari pag ito ay nalalasing. Did you get it? Maraming nabubuo na dapat hindi nabuo. Did you get it? Maraming bumabapang na hindi dapat bumabapang. Kaya mag-ingat. Baka matuklaw ka ng itong relasyon. Okay? So before the actual data gathering is suggested that the nurse meet the people who will be involved in the data collection. During the community exposure, guys, during the community exposure, if there are 12 of you, hindi lang po kayo ang magtatrabaho. You have to involve the people. So like literally, you have to get someone from the community that will help you in the data collection. But upon choosing these members of the data collection team or partner research team na gagawin nyo sa community, you also need to inform them. You also need to orient them on ways on how to collect data, paano natin gagawin ito, at ano yung mga dapat at hindi dapat natin gawin during collection of data. We will also try to train them to answer possible questions that may arise during the data collection. Or, mas maganda nga, body-body system, one outside resources, which is us, and one insider, which is a community member. So, kayong dalawa ang magsasama, then you go to specific houses, then so on and so forth. So that you will also help him and train him at the same time during the collection process. So before kayo mag-collect ng data, it's very important that you need to what? You have to have a meeting, community meeting with the chosen individual who will help you in the collection of data in the community. Are we clear so far? Yes. So the instruments are discussed. and analyze if necessary the estimates may be modified or simplified in order not to overburden the people who may have limitations in terms of educational preparation and our available time to finish the data collection. Pre-testing of instruments is highly recommended. Ibig sabihin, you try it with them. Question. When we try to ask for a community member to become a member of the research team or the collection team, kailangan po ba college graduate? No. Okay. Ang importante, they are able to read in write. Okay? So we don't go to specific na kailangan nakagraduate sila. Kasi malamang kung nakagraduate ka naman sa community. Nagkatrabaho po yun. Did you get it? Yes. Okay? So when you choose people in the community that will help you in the collection of data, we have to make sure that they know how to read and write, and of course, they are willing to go for home visit, hike the mountains, cross the river, swim the ocean. Di ba? Literal, if you go to southern Philippines, yung mga malapit sa shore, of course, literally, lalo pag may mga island sitos. Of course, sa Baguio City, walang island sitos dito. Kasi in the first place, wala tayong dagat. Pag dito umabot ang dagat, end of the world na yun. Burnham Lake. Okay. May fishing event sa Burnham Lake, di ba? Ang palong, mayroon ka bang mag-fish? Kailangan ng rod. Okay? So steps, after data collection, the nurse is now ready to gather all the data information. There are two types of data that may be generated, and they are either numerical or descriptive data, or the quantitative and the qualitative data. So basically, the numerical data are the census, for example, ilan kayo sa pamilya, demographic, ilan ang babae, ilan ang lalaki, tama? Descriptive are the opinions, the perceptions, or the cultural beliefs that the community people or a specific member of the family or of the community shared to you during your interview. So basically, ito nakukuha natin during interview and observation, while your descriptive data naman is during interview and sometimes observation depending on the types of data that we want to collect. Okay? To facilitate data collation, the nurse must develop categories for classification of responses, making sure that the categories are mutually exclusive and exhaustive. Ibig sabihin, this would help us to categorize the data later on. Okay, to come up with a single problem. For example, kapag sinabi ng community na high blood, diabetes, cancer, automatic ay kakategorize mo sila as lifestyle-related conditions or lifestyle-related problems. Are we clear so far? Okay. And these are examples. So mutually exclusive choices do not overlap. For example, to classify sex. Either you classify it male or female. O baka may magtanong na naman, sir. So asan yung third sex? Ito lang po kasi nasa book ni Maglaya. Kaya huwag po kayong magagalit sa akin. Kinopya ko lang naman po kung anong nasa aklat. Wala po akong any prejudice or something. Ayan po ang nasa aklat. Nagkakaintindihan. O kung gusto mo idagdag, o pwede naman. Category. Okay. Kung gusto mo na, ano ba ilalagay mo ba? Okay. At huwag ba maaari kapag to classify sex, gender na lang ang gamitin? Okay. Kasi kakaiba pag sex. Baka ilagay nila yan 3 times a day. Gano'n. 2 times a day. Okay? So to classify monthly income. Ito ba? Ganito? So below 500 pesos, 500, 1 to 1,000 pesos, 1,000 to 1,500, or 1,500 to 2,000 pesos. O depende dun sa category na gusto nyo i-categorize. Okay? Based on the salary system na meron tayo sa Pilipinas. So ito na yon. Okay? Categorization of your information. Okay? So, nabigas nyo naman ito, tama? Kasi ginawa nyo sa community. Another one is in collating and fixed response questions, choices must be provided which will serve as categories for the respondents' answer. In some community diagnosis, designs, data collectors, flashcards will help the respondent choose his answers. So open-ended questions do not provide choices or categories, but the nurse can still facilitate data collation by constructing categories from answers in randomly selected questionnaires. What do I mean with this? For example po mga kapatid. Okay? Question. Bakit hindi kayo nagpapasuso ng inyong sanggol? Okay, these are the responses na meron. Merong bawal sa akin, nagtatrabaho, ayaw minister, ayaw konstanto, masakit, ay, depende kung sino ang, depende naman, masisira ang figure, ay, maarte, did you get it? Medical reasons. Baka daw may mastitis. Baka naman daw may inverted nipple. May sakit ako. Modern and convenient ang bottle feeding. So pagod na ako pagkagaling sa trabaho. Mas gusto ko ang magpasuso sa bote. Okay. So if you're going to categorize them, you can categorize them using this. Okay, like for example, category based on convenience. So the response number 67 and 77 is specifically based on convenience of mother. Okay, or due to medical reasons, like responses 10, 16, and 62. Okay, or for personal reasons, responses number 30, 45, and 59. Masisira ang figure ko. In the first place, walang masisira. Kasi matagal na. Or economic and work reasons, such as response number 27 and 75. So that's how you're going to categorize the response. Okay? In that case, ma-identify mo dito. Ano ba yung problema talaga ng pasyente? O ng pamilya? Is it economic status? Baka more on to ano to? More on sa kanila, more on foreseeable crisis or stress point. Diba? Is it personal reasons? Stress point pa rin yan. Okay? Convenience, stress point. Okay? Medical reasons, medical status, health threat, or even stress point. You categorize them. And in terms of community response, pwede mo siyang resources, kasi more on trabaho. So baka resources, kasi kailangan ng magtrabaho. Or medical reasons, pwede siyang community health, status problem. Or convenience, ano yan? It's more on health-related factors. Ayoko. Kasi factor yun. Self-factors yun. And personal reasons is also self-factors, so health-related factors. So that's how you're going to categorize it. It's easy for me now to discuss this kasi nga nagawa na natin sa area. Okay? Okay, wag mo yung tingnan rin yung maaga pa. Maaga pa sa oras ko. Maaga pa sa oras ko. Next, the next step after categorizing the responses will be to summarize the data. So in summarizing, there are two ways to summarize the data. Number one is you can manually tally the data by using computer. Did you do this? Yes, you did this per group, tama? Then you compile as a section. Or tallying involves entering the responses into prepared tally sheets, old school. Since kayo, magagaling na kayo, you make use of Excel, pinadali ang trabaho. Okay? So that, after tallying the data, the next step after categorizing the responses will be summarizing the data. Okay? So for example, disease, parasitism, diarrhea, cough. So tally mark. So for example, these are the diseases na meron tayo. Tally mark, then frequency. Ilan? So based on the numbers, frequency is very important. On what criteria? Sa community health status. Finding out the frequency, kung gaano karami. Yung nagkaroon ng specific disease is very important in identifying what score nung community doon sa specific category na ito. What specific criteria? Your magnitude of the problem. Remember sa magnitude of the problem? So basically, you would try to relate it kung gaano karami ang naapektuhan sa hindi naapektuhan. So for example, if there is a total 1,000 population in the community, ang merong cap is 33. So 33 over 1,000, so whatever the score times 100, yun ang percentage. So yung percentage na yun, i-compare natin doon sa criteria natin. So is it 0 to 25%? 26 to 49? Then, ano naman?
50 to 70.
50 to 74, then 75 to 100. Then the score is 1, 2, 3, 4. So depende kung saan pumasok yung percentage ng data. Clear tayo? Yes. Okay? So the data gathered depends largely on the type data obtained. The descriptive data are presented in the narrative reports. Examples of data appropriate for descriptive presentation are geographic data, history of place or beliefs regarding the illness and deaths. So numerical data may be presented into tables and graphs, just like what you did during your community output. Okay? Of course, the data in numbers presented in graph, while ito naman is presented in descriptive, depende doon sa paniniwala. Okay? Actually, yun yung kulang doon sa part natin, pero okay lang. Si person natin gumawa nun. Yung description of the community's relationship towards another, how is their ethnicity, how is their cultural beliefs in terms of health. Okay, and that is the descriptive, what the numerical data such as the vital statistics, how many died from this disease, ilan ang babae, ilan ang lalaki, that will be presented through numerical data through graph. Okay, we're almost done for today. So, steps in conducting community diagnosis. Okay? And when you present the data, the numerical data through graph, you may use the type of data graph. We have the line graph, shows trend data of changes with time or age with respect to some variable. So basically, this is very important kung gusto mo makita yung pattern ng increase and decrease. So it shows a trend. So, for example, you want to check the trend of the occurrence of COVID-19 infection in the community for the past month. Okay, for the past 3 months, then you're going to compare. Okay, kung paano yung pagtaas niya from the start no vaccine until nabakunaan lahat. Is it uprising or downrising? Okay, kung marami ba alam po konti. We can also make use of their bar graph or pictogram for comparisons of absolute relative counts and rates between categories. The histogram, frequency of polygon graphic presentation and frequency distribution of measurement, and the proportional or competent bar graph or pie chart shows breakdown of group of total where the number of categories is too many. And based naman po sa inyong binasang output, this is actually followed. This one actually followed. You're very good with that. Of course, another one is scattered. Diagram correlation data between two variables. And I believe these are the same types of graphs, or at least one of these graphs you will be using in your researches, especially if you are doing a quantitative research. So, sino po naka-quantitative research dito? Meron, I mean, nag-quanti pa din. Akala ko masyado na kayong kung talaga nag-sound na kayo sa quanti, lahat yan nag-quali na eh. Sino naka-quali dito? May nag-push pa rin ba na experimental? Push na yan. 25 ito ngayon, hopefully. 25 ito. Ha? Pinilit. Pagpinilit kayo, pagpilit kayo. Kaya niya. Okay? Okay? So data analysis. So after the presentation of data, okay guys, after natin na-form into graphs yung mga data, these graphs will be then used to present sa community. As nakikita ng community through graphs, yung graphic presentation of the findings or the data that we have collected, and from that, the community and the facilitators from outside the community, which is us nurses, are going to decide together. Okay? So ano ang ating function bilang outside resources? We give technical support. When you say technical support, in case na meron silang hindi naiintindihan, then that's the time na mapasok tayo and explain sa kanila. But we should not dictate, we should not suggest, we should not advise. We just explain things to them, then it's up to them kung itatanggapin nila yung reasons na yon, then they will decide as a community. Are we clear? Then that's the time we are going to analyze, or they are going to analyze together Okay? So in the community, in determining the relationship of factors that will help the view of the problems and their implications in the health of the community. It's very important that they are aware of the community health problems. Why? Because they will be the ones going to address that concern as well. Okay? Do you have any questions so far? So we will end the discussion here. Okay? Our next discussion is about the identification of community health problems, which is your community health status problem, your community community health resource, and community health related factors. We might have a quiz by Saturday, so please wait for announcement. I'll be constantly communicating with you guys to our chat room. Tungkol dito, tsaka sa isi-send kong video. So, this is the first day na nag-discuss tayo. Second day, so basically, meron lang tatlong araw for the lecture ng community. And I still have 2 more modules that I need to cover. Anyway, yung two modules na meron nila, medyo madali na lang i-discuss ko. Okay? So, do you have any questions? Any questions? Clarifications? Violent reactions? So, yes, meron. So before you leave the classroom, don't forget to pick all the dirt sa inyong mga mesa, sa inyong mga sinupuan. And if you don't have any questions, thank you for coming into our class. Have a safe night. Bye.